Informed consent is all about making decisions backed by information you actually understand. And informed consent is a critical part of you having an empowered pregnancy, birth, and postpartum experience. The two key components of informed consent are comprehension, really understanding the information that's being presented to you, and free choice. So the ability for you to understand the information and then being able to make the decision that makes the most sense for you without any influence. A great example of informed consent and how it might apply to your pregnancy and birth might be in your birth preferences. Leading up to your labor or during your labor, breaking your bag of waters or AROM could be an intervention that might be offered to you. Prior to labor, it could be an intervention to induce or start your labor. During your labor, it could be an intervention to help accelerate your labor. Now, informed consent would be you having education and information on exactly what happens when your bag of waters is broken. Your care provider then would ask you for permission to utilize this intervention, and you would be able to say yes or no based on that information. Now, if you're taking a class like this, you will have that information available to you to make that decision. However, if you weren't aware of how something like breaking your bag of waters would impact your labor or impact your pregnancy, it would be your care provider's responsibility to explain to you the risks and the benefits of doing that intervention. And once you were made aware of the risks and the benefits, you could decide whether or not you wanted to move forward. That's a pretty simple look at how informed consent works. Another step in the informed consent process between you having the education about the procedure or intervention and you coming to an answer about what you want to do about that procedure or intervention is something called the shared decision-making process. And the shared decision-making process is you bringing in anyone that you consider valuable or important in your care continuum. So that could be your partner if you have one, your doula or your support people, friend, family member. Those people can come together and talk to you about the decision that you're currently working on. And they can bring in their experience and potentially even their expertise to help support you in your decision-making process. Shared decision-making is actually really valuable when it comes to pregnancy and birth. The reason for that is because for many people going through this experience, it's their first time. And there is a lot of value actually in getting communal knowledge and communal information when trying to decide what's going to be best for you. That said, there's a fine line between effective shared decision-making and conflicting shared decision-making. And what I mean when I say that is it is helpful to source that communal knowledge, but the ultimate decision lies with you, and you need to do what's going to feel best for your body. So take shared decision-making with a grain of salt. Let it inform your process, but don't let it decide the process for you. A few other things that are going to help support informed consent and help inform your decision-making process is going to be your ability to ask questions and stay curious, along with using your intuition. When it comes to staying curious and asking questions, I really encourage you to ask your care provider questions like, what are the benefits of the interventions that you're offering? What are the risks of the interventions that you're offering? Are there any other alternatives that I should know about that could be safer, more supportive, or easier for me at this time in my pregnancy or during my labor? These types of leading and insightful questions can help you get to a more clarified answer and help you come to a decision that feels informed and empowered. Trusting your intuition isn't an exact process. Knowing even how to find your intuition isn't a simple task. But What I would suggest as a way to start to cultivate it is noticing what's coming up in your body when you're having conversations or when you get an idea. For example, when you're in a conversation with your care provider, if you notice that your shoulders get tight, that you might be clenching your jaw, even if it's just slightly, or that your stomach feels tight, or that your body language gets more folded in and closer to your body in conversation with a care provider or even a friend or your partner. These are signs that you might be uncomfortable. And sometimes it's hard to even notice those types of signs that our bodies are giving us. And so that's a very subtle body-based way to start to tune into your intuition. Also, another way to notice if you're getting intuitive signals about a situation that could be right or could be wrong for you is noticing if you feel a sense of fear or apprehension, but you can't actually explain what it's about, but you do feel that coming up in your system. That inability to connect a feeling to an actual situation also could be a sign of your intuition coming forward. So, hopefully, those two tools can help kick off you deepening your connection with your intuition. In the guide that goes along with the module for this class, there are a few more tools and tips that you can use to help cultivate and support your intuition in order to help make the informed consent process a little bit easier.